Well, I wanted to start off just quickly going down the line before we get into everyone's story and just say your name, where you're from, how many years since diagnosis. Start with you.
I'm Sue Russell. Right now, I'm from Philadelphia. I live in Bryn Mawr, and as it happens, I work at the American Association for Cancer Research. That's just a big coincidence. I just want to add that I'm from Cleveland. So this is really home for me in a lot of ways, and I had a dual purpose for my being here because I was also visiting my 92-year-old mother. And it's been about 2.5 years from diagnosis. Just after the 2-year point, I developed metastasis. And we're working on that now, and I'll tell you more about that when it's my turn.
Hi, I'm Darlene Harding. I'm from Cleveland, and I am 5.5 years since diagnosis.
I'm Jack Odell. I'm from Seattle, Washington. I was diagnosed June last year, 2013.
Same as me. Jim Taylor, I'm from Buffalo, and I was diagnosed June of 2013 also. And I also want to thank Dr. Singh and Dr. Shustari, who I was a patient with, and I really have to commend them as being wonderful, wonderful people, wonderful physicians. I just can't say enough.
So Jim, maybe you can start us off then, we'll work back.
Okay.
You know, just give us your brief story, and I think it's really important just to say your initial kind of your thoughts on when you were first told that you have melanoma in your eye.
When I was first told, see, I had a very rare condition in 2007 called lattices, which the ophthalmologists will know what that is. But and I started getting separation in the retina, and so I went to called my physician. She sent me to an ophthalmologist in the group, and she couldn't. She said I had to see a retinologist, a specialist. So I saw Dr. Murphy in Buffalo, and he walked me from room to room to room to room, doing these tests, and finally ended saying, well, if I had to take my boards today, I would be 95% sure that you have ocular melanoma. And of course my head went right down. I said, melanoma. Because I had worked in a hospital previously, and I knew that was not good. And so he suggested I could go to New York or Philadelphia or Cleveland. And he said that he had great faith in Dr. Singh. And so I came here, and I immediately knew what he meant. Dr. Singh corroborated everything. I think it was the 24th of June. And then on the following Monday, on 27th, I had a total enucleation. And I think it was a day after, or 2 days later, I was walking through the Rock and Roll Hall of Fame. I didn't feel too well, but it was. But, and then from there, at that time in Cleveland, they only had one trial at that time, and it didn't look too promising. So my wife, being the thorough investigator she is, found a program at Memorial Sloan Kettering and contacted them, and they sent all my results from the DNA testing, the biopsy that was done here, to Dr. Gary Schwartz at that time. And his secretary called me up and said I was a fine candidate. I had a wild card, whatever that means. I don't know what that means. My DNA testing or something. So I fit into what their needs were. And I went on the seluminative for 10 months, and it worked fine right up until about the end of that, and all of a sudden it stopped working. So Dr. Carvajal suggested I see Dr. Aaron Jerry to do a embolization procedure, which I said, okay. That was done in July, and some doctors I spoke with said you might feel some pain, you might double over with pain. I didn't have much pain. I had some, but not a lot. And what I did almost fall over with was the reaction to the drugs. It was horrible. After that, I came back. Dr. Carvajal said that I could take 3 months off, and I came back and saw him in September, and we did a CAT scan, and he said there was showing no growth. So, but at that time, he whispered in my ear that he was moving on, and so I said, well, I started out with Dr. Schwartz. I liked him a lot. I liked Dr. Carvajal. So I called up Dr. Schwartz at Columbia and saw him on the 16th of October. And this Monday morning, I'm having a CAT scan to see how the progression is. And he wants to see me either soon after he gets the results, or if the results show no growth, in January. And that's where I'm at right now.
Jack?
There you go. I was diagnosed last June. I had a scheduled ophthalmologist appointment, dilated, and I was diagnosed with a benign cyst. I was also told I needed to see a specialist 1 week later, where I was confirmed with ciliary body ocular melanoma. My size was high side of medium. And for several reasons, size of my tumor, location of my tumor, and my desire to keep my vision, John and I decided on proton beam radiation. He did his research and he found the man we wanted, but he was in Liverpool. And we were set to go to Liverpool, and John found out our man was on the move to San Francisco. Dr. D'Amato. I had an eye exam on July 8th, and I had surgery with Dr. D'Amato on the 9th with a Castle biopsy. I was Dr. D'Amato's first surgery in the United States. I think he's a wonderful surgeon, and I hope I can say he's a friend. I had proton beam radiation at UC Davis, July 22nd to the 25th. Back in Seattle, July 31st, I had an MRI scan, a CT scan, both clear, and I was declared NED. Following an eye exam, 20/20 in both eyes.
Excellent, excellent.
3 weeks later. 2 weeks after that, Castle results came in, and I was type 2. It was the first blow to the gut. We hired in Seattle a man who billed himself as a cancer treatment consultant. A cancer navigator is his name, Hartmut Stritcher. He's a prior lab gene researcher, and he's our go-to consultant. John and I visited 3 of the main doctors at the time, and we visited Dr. Patel at MD Anderson, Dr. Sato, and Dr. Carvajal. At the time, the adjuvant treatment pretty much was limited to Yervoy or Sutent, and the last one we were told was watch and wait. Watch and wait isn't our vocabulary. No. We decided to go talk to, first, in August, September, we were determined to get second generation gene testing. We worked with Dr. D'Amato through Foundation Medicine. And we were instructed that you basically have 2 chances to get gene testing. One is at the treatment of the main tumor, and second, in a 2 to 3 month window after the main treatment. Dr. D'Amato said that's pretty typical in the UK and Europe, whereas not so in the United States. So we jumped on it, and I had my testing. Foundation Medicine gene test was 256 genes, and it resulted in me being a BAP1 gene mutation and a GNA11 mutation. The Cancer Navigator did his homework and said there's no known publications or research findings for GNA11. He said for BAP1, HDAC inhibitor was the way to go. We went back to Dr. Patel. We settled on a small group off-label use of a cancer drug called Zolinza, Verinostat. It's an FDA cancer drug targeting BAP1, and I began treatments on December 5th last year. 600 milligrams on 2 weeks, off a week, and my platelets dropped to 25. So everyone on the study was dropped to 400, and I eventually had to go down to 200 and build my way back up. It was a group of 5. One person dropped out because he didn't get insurance coverage. 3 people got partial to full insurance coverage. John and I jumped in, paid out of pocket $9,000 every 3 weeks for the drug. We submitted our claim to Regents Blue Shield, and we were denied. So I worked from July 31st to, well, platelets crashed. Weekly blood tests, 3-month MRIs, 6-month CT scans, and from July 31st to July 31st this year, I've been NED. July this year, I stabilized on Verinostat at 200 milligrams, so we transferred my care to Seattle Cancer Care. My upcoming scan is November 3rd. I'm on the steering committee, so I learned early on that 80% of us are newly diagnosed or newly treated, and I remember from last year, being a newbie, how overwhelming it was, and I wanted to ask myself, what do I want these people to take away? Number 1 was consider gene testing. I recommend getting 2nd-generation gene testing. I want to say get gene testing. Castle gene testing is not something that can be used for targeted therapies. My secondary gene testing resulted in knowledge of gene mutation in BAP1 and GNA11. And Colleen, thank you for your explanation. With this information, first, we fought Regents Insurance Company. I'm going to just read this. Jack has undergone first-line radiation therapy in June 2013. Subsequent molecular tests revealed that Mr. Odell's ocular melanoma belongs to a highly aggressive subgroup class 2 with a mutation in BAP1, as detected by 2nd-generation gene sequencing. These findings put Mr. Odell at a high risk to develop life-threatening metastases. And it goes on to say, it has been shown that mutations of BAP1 are strongly associated with metastases, and that this can be reversed by treatment with HDAC inhibitors like Zolinza Verinostat. In conclusion, Mr. Odell's uveal melanoma has been diagnosed as class 2, high risk of developing metastases. Mr. Odell's tumor has been extensively tested by next-generation sequencing and has been found to harbor the high risk of BAP1 mutation. And last, HDAC inhibitors like Zolinza Verinostat work reversing the negative effects of the BAP1 mutation. With the testing and with the wording, we beat the insurance company, and we received a huge refund check. Second to that, we had an opportunity this past March to hear Dr. Sondek speak in Los Angeles. And I'm going to drop a bomb on you. John and I are personally funding our own research project right now. Dr. Sondek spoke of a recent lab work dealing with GNAQ and 11. His research ended without conclusive evidence on GNAQ. Colleen's explanation was much better than mine. This is how my simple little design mind works. I see a gene cell growth signal transmission stuck in on with related GNAQ and 11. I'm the 11. The doctor had inconclusive results on GNAQ. So So John talked to Dr. Sondek at the conference, as did Dr. D'Amato. Why did we jump on this study? It was an existing lab thesis protocol and approvals were already in place. The initial costs for the university or the hospital were covered. Research was filed as a continuation of existing work. The research project needed only funding to hire a research assistant or a scientist. We avoided time delays, we avoided startup costs. We did not involve interaction with any of the drug companies. Our goal with Dr. Sondek is to find a drug or a combination of drugs previously approved by the FDA to turn off GNA 11. John and the Cancer Navigator discussed with fundraisers, and John worked on the letter. He asked for financial support from our friends and clients, which they had already previously offered. We sent out 40 letters, and in 6 months we're up and running. The research began mid-August, and the results are due in 18 months. And John was well advised. He tied the last payment to a requirement to publish all his findings. At most, if successful, it would be an insurance coverage issue, not a long FDA review and approval issue. That's it. Thank you.
Hello, I'm Darlene, and I was diagnosed in May 1st of 2009, and prior to that I had enjoyed phenomenal health. And actually the day that I was diagnosed, I was about a month, I'd already celebrated my 50th birthday, and the day I was diagnosed, I was training for a marathon to celebrate 50 years of good health. I wanted to celebrate it in a unique way. I had done 10 miles that day and went to my optometrist appointment, and I had been experiencing once in a while, and it went on for a couple weeks, probably about 6 weeks, when I'd go to bed at night and close my eyes, I would see like a bright pattern, almost like those little things you look through, the little kaleidoscope things. And it would be instantaneous, it would go away, and I was due for an appointment soon, and I was training for this marathon, and I was, I had my 50th birthday, and I just sort of blew it off. I didn't panic, and so anyway, which is very unusual because I've always been one to get things checked out right away. I'm a nurse. I was a nurse 29 years when I was diagnosed. I should have absolutely known better. And so the day that I did the 10 miles, I went to my optometrist, told him the symptom I was having. He sent me to a retinal specialist and then to Dr. Singh. So within the end of the day, I was a panicky cancer patient. So I totally did a 180, in a couple hours, which was just overwhelming. So the importance of getting unusual symptoms checked promptly is something I just wanted to mention, especially with, a number of you, fearing metastasis, in any of your body parts, respiratory, cardiac, if you're feeling more tired and all that, because I really beat myself up when I was diagnosed. Why did I let that go? Why didn't I check that out? But I had to let it go because it wasn't going to help me, obviously. And I also realized that it could have been there for years, and my delay was sort of irrelevant in the big picture. So I did, have to forgive myself, and I did. But mainly my two main emotions were just shock and awe, like the one gentleman said. I mean, like I said, I'd been healthy my whole life, and I I felt like my body betrayed me. I had taken care of my body. I had eaten healthy. I had exercised. I, didn't do drugs and all that, and I just really felt betrayed by my body. Another thing I wanted to mention is being a nurse. Being a caregiver is one thing. Being the patient is totally different. And I think that going through the experience of being a patient at least once, helps you as a caregiver in your delivery of, your caregiving perspective and your delivery. I had never felt so vulnerable in my entire life. And so the little things that nurses did, or doctors, you know, even introducing themselves warmly, asking me if I needed anything, those things went such a long way. I was very hypersensitive to both brusqueness by my caregivers, which I didn't really have any of that, but I would have been sensitive to that. And I was also very highly sensitive to the kindness that they gave me, because I was just so afraid. But everybody was very wonderful. But being a caregiver in any capacity is a very weighty responsibility, but it's also a very influential privilege that you have to be, you know, and you should not underestimate how weighty it is, because it truly is. Small things that you do make a huge difference for the patient, whether it be your family member, you know, friend, whatever. And I just wanted to, I did let fear get the better of me. Dr. Singh and Dr. Triozzi told me that I did not have any Mets on my original CAT scan. My liver was good. There was a little blurb on my CAT scan that said it recommended a triphasic CAT scan, which I guess is a little bit more, shows you more things, based on the fact that it looked like I had suspected hemangiomas. And they never mentioned this, getting this test, but I noticed it in small print. So it became my mission to get this test, because I was very afraid that they were considering them hemangiomas, and even though you said they are very, kind of specifically and easy, you know, they're highly, you can tell a hemangioma versus something else. In my mind, I was afraid that when I went back to my 6-month checkup, it would be like, are bad, they were really Mets. And I just was so fearful, and I couldn't bask in the good news. I couldn't bask in the fact that I had that everything was good, because I was thinking that it was inaccurate and they were really misdiagnosed. And part of that could have come from my nursing. I don't know, knowledge, sometimes too much knowledge is not a good thing. But anyway, I did get that triphasic CAT scan, and I'm now 5.5 years out. I'm ready for my 5 years. Every 6 months, everything has been good. The hemangiomas are hemangiomas, thank goodness. And they're checking them, all the time. And my liver function tests and everything have been good. Your treatment is very personal. When I was given the diagnosis on May 1st, I did not waver at all. I mean, my radiation, enucleation, I did not waver. I know for me personally, I wanted the enucleation. I wanted it out of my body. That's me. Dr. Singh also mentioned that he couldn't guarantee, being that it was located near my optic nerve, that I wouldn't more than likely lose my vision over time anyway. So to me, I just wanted it out. And I had no post-op complications. I had a wonderful ocularist that I was also local, which was great. The first eye that he made me, it was too light, I felt, and he was very generously made me another one. And I'm happy with this one. I think I adapted pretty well visually. It's weird, when you look at things, it's like it's almost like you're seeing with two eyes. I thought that it would be like, I wouldn't see this side, but your brain, it looks like I'm looking with two eyes. Right. And my prosthetic is so comfortable that I forget I even have it. So that's really good. And what else did I want to say? I did not surf the web. They pretty much recommended me not to do that. They said it would incite additional fear. They were very, good about answering questions, and I just didn't do it. I mean, I probably should have, because maybe I needed more information. I actually learned some things today, and not some good things, really, because I was feeling pretty, I'm serious. I was feeling very comfortable in my 5.5 year, I do have the less aggressive of the types, but now I thought it was 2 types. I thought it was more aggressive, but now I'm seeing there's actually 3, like class 1A, 1A and 1B and whatever. But anyway, I have the least of the aggressive types, which was wonderful. I didn't have any medical treatment at all, just the enucleation because of that. And what else did I want to say? I did go on and do that marathon. Yeah, it was 6 months after I had the surgery. And it was really wonderful because I was re-celebrating my wonderful health, and so it was very special. What else? I'll just last little bit. Although my journey was brief and I got through it physically unscathed, as far as I'm concerned, it was nonetheless a profound teachable moment in time, an emotional roller coaster, a midlife wake-up call, and so many different levels. One of the things that I thought was really, when I was thinking that, when I was thinking that the fear of the unknown, I didn't know if they were going to find meths, and I didn't know what was going on, and it was really interesting that when I look back at my life, I was not regretting things that I had done. I felt like I made good decisions in life, and I lived a good life. I treated people well, and I was regretting the things that I omitted. Why didn't I take more chances? Why weren't I more fearless? Why did I worry about what people thought of me when I was doing things? And so 5 years out, I'm more creative than I've ever been. I'm singing, I'm writing, I'm playing the guitar, I'm taking chances. I'm just not worrying. Life is so short. I found out singing at the age of, 3 years now. At the age of 52, I found out singing makes me very happy. So I want to be happy. So I'm singing as often and as long as I can and as often as I can, because life is short, it's unpredictable. And I'm also in the process of writing a book. It's just what, when you're looking at your life and thinking you never expected that it might end in your 50s, it just really opened my eyes up to a lot of things, and it's been put on my heart to share some of those things that I thought about and whatnot, and it's taking much longer than I thought. It's much harder than I thought, but I'm close to being done, and I will do it. It's really been put on my heart. It's one of those things that I will regret forever if I don't do it, so I will finish it. But so going through the bout with cancer made me realize more quickly how time is passing, what a gift it really is, and how predictable life can be. I do believe I have an increased awareness of all that is good in my life, and the extension that I've been granted in my life has truly been a miracle. Thank you.
Hi, I'm Sue Russell, and I'm hearing things I have in common with several of you, and also the two of us. Jack and I discovered that we're both from Cleveland. And here we are. But I also had lattice. Oh. It was.
Welcome to the rare club.
But then I had retinal tears, and I had several retinal tears, and that got me to. I live in Philadelphia, and it got me to Wills Eye Hospital. I had maybe 4 tears, a couple on my left eye, a couple on my right eye, and they used laser treatment for that. And I wasn't terribly worried about it, and it's still sort of considered a coincidence and not related to the ocular melanoma. But whether it's a coincidence or not, it got me treated pretty quickly because I had some of the same light show effects you were having, and I had also been warned by the retinologist that if I started seeing a shade drop within my eye, I should go immediately to the emergency room. And one day I was walking from the train into work. I also worked in Center City, Philadelphia, and I saw that black shade coming from the side, and I thought, I better do something right now. So I called the retinal specialists at Wills. They made me an appointment. They said, come in tomorrow. So I did, and I thought it was just something else with the retinal tears. But when I went in the next day, I had 1 doctor in the office, and then 3 doctors in the office, and then 5 doctors in the office, and everyone was running around. And I asked what was going on, and they didn't quite want to tell me. They were a little bit concerned that maybe it was metastasis from something else. But my personal retinologist said he was pretty sure it was choroidal melanoma, and then he said, we're going to refer you to the Shields. And I thought that sounded like maybe a treatment. I didn't know what he was talking about. But the Shields are Jerry and Carol Shields, who are the power couple of ocular or uveal melanoma, and they also work at Wills in that same building. So basically I went upstairs, and we went on from there. It turned out that I had a choroidal tumor. It was considered medium to large. It was wider than it was deep, and depth was considered the more important measurement in that case. It was about the size of a penny, I believe. And they felt that they could do the plaque for me, and I decided to go with that. And before the plaque was put in place, I got needle biopsy for a sample to use for genetic testing. And in Philadelphia, with these doctors, they use a different kind of genetic test that's run through the University of Pennsylvania. I got that, and then we said, we'll let you know in about 3 months what's happening. So it was a nervous 3 months. I wasn't all that worried. But I came out the equivalent of class 2, although what they would be class 2 with the Castle testing. I was told I had a 50 to 70% risk. And then they sent me down the street to Dr. Sato at Jefferson. And this is one of the most fortunate things in my life, that I happened to move to Philadelphia, that I work at the American Association for Cancer Research, that I'm around the corner from where the best care is. And there's so many people who have to travel from all over, and I don't. I just, you know, that's a wonderful thing. But when I first saw Dr. Sato, we set up a regimen, and I went on Sutent as an adjuvant treatment. Most people do it for about 6 months. I really was not having particularly difficult side effects, so we just kept going up to a year, and I thought, well, the more I do it, you know, the better my chances will be. And I was pretty happy. You know, I got to the year, and I was doing the scans every 3 months, and sometimes I'd see a little spot, sometimes it was a hemangioma, and then it would go away, and everything was just going along, and I thought, well, maybe I would beat this thing. But a couple months past the 2-year mark, which was right around the time that metastasis could be expected, that's when the metastasis was found. But I had this was in about June of 2014. They saw on my MRI 3 very small lesions that appeared to be metastatic. Only one of them was just about a centimeter. The others were millimeters. They were all small. Dr. Sato wanted me to have an ultrasound biopsy, but he said, you know, they may not be able to see it. If they don't see it, we'll just have to wait a little while and see what happens. But he had 2 favorite interventional radiologists, and he said if one of them can't find it, then can't see it or can't find it, then nobody could. So he sent me to this miraculous little woman. I mean, I'm saying little woman because she was about 4'10", I think, Dr. Shaw. And she was just fierce. And it was a strange, I got the biopsy, I had someone pressing down on my liver. I was conscious. And I was watching her looking up at the screen, and it was one of the most amazing experiences of my life. I felt like the way I felt sometimes when I'm looking at a map and I don't really know where I'm going, because I'm not that great visually, but she's going like, and I thought, she's finding it, and she did. And although it wasn't good news to get the confirmation that I did have metastasis, they found that the largest of the lesions, I knew that would give me a diagnosis that would get me into treatment, and I really felt better knowing than not knowing. And Dr. Sato and I discussed a few different options for treatment at that point. But I could tell Dr. Sato was leaning toward one option for me, and I decided to go with that. There was one place left, the last in a cohort for phase 1 trial of an anti-PD-L1 drug that's from MedImmune, and the name is like MDX34 or whatever. It doesn't have another name, but I don't understand this scientifically, but I can tell you that it's the ligand that goes along with the with PDL that we saw in some of the slides. It works in a slightly different way, and one of the reasons that Dr. Sato wanted me in particular to try it is because on my day job, I'm the senior production editor for cancer immunology research. And he just thought I would be excited about it, and he was excited about it for me. And the other possibilities were CMET, which also seemed to have a lot of good things to say about it. I knew some people who had done well with it, and I could have done the liver-directed treatments, one of them, but he said, you can do that anytime because we have them here. But this study is a limited time, and he said the least it can do is to bolster your immune system, and I was hoping that because I work in this area and I'm familiar with all these acronyms, even if I don't understand exactly what they are scientifically, I knew that this PDL thing was really hot, and it kind of made me excited to be a part of it, and I felt like I was reading my story as I looked at the journals and checked the copy editing, which is my job. We have an offshore vendor doing copy editing, and that's a really weird thing. But that's part of my life, and then I yell at them when they get things wrong.
So Sue, what would be the one thing that if you were to go back to when you were first diagnosed that you would tell yourself?
If I could, I guess similar to what you were saying, I wondered if I think I started to see the weird light thing going on a little earlier. At first it was once, and then it was a couple times. I wondered if I should have gone in earlier, but I don't know that would have made any difference. I don't know if that's are you asking me, looking back, what I would have done? Or?
Just given what you know now, and I'd like to just hear quickly from the rest of the panel, what is the one thing you know now that you wish you could go back and tell yourself when you were initially tackling that diagnosis?
I know what I would do. I was, when I saw Dr. Murphy in 2007, he told me that I had a fairly large nevus. And he said, well, you should just continue watching it. And he said, just go to your doctor, and meaning ophthalmologist. So I went to the ophthalmologist that was at one of the groups where I got my glasses and stuff like that, instead of going back to Dr. Murphy. And that was my mistake, because right in black and white in 2000, I think it was 2010, when they did my surgery for cataract surgery, they had written out that large nevus, and as Dr. Murphy said, you don't say large nevus in the same sentence without flags going up all over the place. But they never sent me anywhere. They never told me.
And there's so many stories like that, and that's really unfortunate. But I just want to go back to what you were saying, and something that made it a little less scary for me is that because I'm in Philadelphia, and a lot of people come into Philadelphia for their treatment, I had met a lot of wonderful, brave people from all walks of life and from all over the country who had metastasis, and they were some of them became very close friends. And it made me feel that if, you know, if Andy could do it with her 3 daughters, if Cheryl could do it and run a marathon, then I could do it. And that I had to have hope, and I saw that people were living good lives. None of us knows the future, but it was really helpful to get to know some other people through what an editor of mine calls the what's he called, the virtual posse for this disease.
That's great. Well, are there any questions from the audience? We can do a few quick questions, and then we do have to move to the caregiver panel.
I just want to say, Sue, you're our affiliate.
Well, thank you. It's because I think I helped somebody get directions from the airport to.
Angel's coming all shapes and
thank you.
sizes.
Oh, by the way, stable disease as of last set of scans. I'm back on November 3rd.
Great. Well, thank you all again for being up here and sharing your stories. These are remarkable warriors.